In this video, we're going to be showing the other things that chiropractors can do in the office, and in my office we treat extremities as well. A lot of patients come in here with things that happen with the elbow, and that's what we'll show today. Tennis elbow, bursitis. There is a bursa that's in the elbow, and they can become inflamed, and adjusting it and treating it does help out a lot. So luckily I got a volunteer that's going to help show how you do this in our office. Alright, so this patient right here has got a lot of bursitis going on right under the elbow. So you see when you bend your arm right there, see a lot of discoloration, things like that in that arm, which causes a lot of inflammation and like red or burning sensation. You relax your arm. Now what we're going to do first is we're going to do some cold compress and actually ice it and get that inflammation down, a little less angry at us as well. Is that okay? Well, this right here, the ice will help him like with any of that inflammation all around there. So the bursa sits right here, right there. And it's very superficial, so it can be irritated fairly easy.
The arm may have got jerked a little like that.
Yeah, that hyperextension can cause a lot more inflammation. So if someone falls on an outstretched hand, things like that, they can cause bursitis in that elbow. The olecranon to come dislocated. It can be a lot of things. Ice also helps with people with tendonitis, like tennis elbow, things like that. Now first, adjusting the elbow is pretty easy, and you'll hear a pop probably with it whenever it comes into there. What you're going to do, there we go. All right, now that we got plenty of ice on it too, and we got it adjusted, what we're going to be using is Groston here, and we're just going to basically just push a lot of that inflammation and move some of that connective tissue, like for like tennis elbow, things like that, out of this joint that can help loosen it up a bit too. Now note that we're just doing the muscles around that bursa. I want to stay off it with the Groston tools because we don't want to irritate it anymore, and really scraping the bursa is not necessary. And also, I love this tool right here when it comes to extremities. Usually it's got so many different types of curves that you can get into every little crevice, which helps. Is that all right? Now, compared to what it looked like whenever this patient came to me first, it definitely has gotten significantly better. The inflammation has gone down quite a bit. He still has issues with it because of his job and him chronically using it all the time. But this treatment has definitely caused those symptoms and those types of episodes to really reduce. So, ain't that right?
Yes. A lot less doctor visits.
You've had injections as well with it?
Many injections. All right. This is cutting those out.
Good. Let it bend. All right, let it rest here. Good. Okay, relax. Bring it down there. Well, that's it for this video. Just a few things that we do here in our office to help with bursitis and elbow issues. So make sure you come back and see us again, and before then, stay active and healthy.